we know that you don't treat Princess Catherine, not your patient, but you do treat a lot of women like her who are in their 40s with young children at home. What are some of the challenges, when they learn about this, that they have cancer?
Yeah, I do treat a lot of women in their 40s and younger. And I think particularly when a woman comes in with a new diagnosis of cancer and she's a mom, as we all know who are moms, what comes first is always your children. And so the biggest concern is often their children. And the cancer is really something that's secondary on their mind at first. And so I really try to focus on letting me and my team focus on the cancer and really trying to help these women still be moms while going through their treatment.
All right, so Princess Catherine, as you know, is just 42 years old. I have to be honest with you, I'm right in that age demographic. My wife and I are, and we know several friends who were recently diagnosed with various types of cancer. It seems like we are hearing about more cancers in more younger people. Am I right about that? And what is the cancer risk for someone in their 30s or 40s?
Right. It's still very rare, and it really completely depends on the type of a cancer. And so it's hard to give a number that everyone's risk, but we are seeing more cancer, like higher numbers of cancer under the age of 50, which is in the younger population. And I do think we all wonder why that is. And we're not sure if there's genetic factors or environmental factors, or are we just having better screening? But on the same side, we're also seeing lower rates of death. And so I think that's a positive.
Yeah, that is a positive.
It is, for sure.
Yeah, there may be other women out there thinking, if cancer can happen to her, it can happen to them, right? What do you want people to know?
Right. I think the word cancer scares us all. Yeah. And it's one of those words you never want to hear. But I can say that while we do see cancers a lot and we're diagnosing them, we also cure a lot of cancers. And we can't prevent all of the cancers. We can't even do anything to prevent them ourselves necessarily. But what we're seeing now is that treatments are so much better. 10 years ago, there were women who, if I were treating them for the exact same cancer today, they wouldn't have been alive 10 years ago. And I'm seeing more and more women cured all the time. So I would say that I think there's always a lot of hope and a lot of positive.
That's right.
All right. Dr. Robeson, thanks so much for your time. We appreciate it. And thank you for the work you do.
Thank you.
Thank you.